Hi, I'm Dr. Brian Goldman, an ER physician and a medical broadcaster. Back with more slang from my new book, The Secret Language of Doctors, in which I explore the mysterious world of made-up words used by doctors, nurses, and other health professionals to talk about the things we do looking after you. The hospital slang I want to tell you about this time is the word Gomer. In the 1978 novel The House of God, which was set in a hospital in Boston, author Dr. Stephen Bergman defined Gomer as a patient who is frequently admitted to hospital with complicated but uninspiring and incurable conditions. In Bergman's novel, Gomers were mostly elderly patients with dementia. They're often admitted to hospital not because they have a life-threatening medical problem that needs fixing, but because they need to move into a long-term care facility. With an aging population, the healthcare system is taking care of an increasing number of people like that. Bergman wrote that Gomer was an acronym for Get Out of My Emergency Room. But that's an East Coast thing. In the southern U.S., Gomer referred to Gomer Pyle, after a 60s TV sitcom about a Forrest Gump kind of guy who joins the Marines. As soon as med students and residents read the book and learned the word Gomer back in the late 70s and early 80s, they started using it on the wards. Saved another one, said the junior resident who's training to be a surgeon. I just spent 5 hours helping remove a cancer from an 84-year-old guy's lung. Hope he remembers to thank you, said his pal who's a resident in internal medicine. The resident in surgery sighed. Are you kidding? He's a complete Gomer. He can't even remember his own name. These days, the word Gomer is considered passé, but there are modern synonyms, such as social admission, failure to cope, and an even more horrible phrase, failure to die. The slang is awful, but I want you to know about it because of what it reveals about the culture of modern medicine. The doctors and nurses who use these terms say they're frustrated and even morally distressed by ordering invasive and sometimes painful tests and treatments on patients for whom they believe it is futile to do so because they believe that no treatments will restore those patients to a decent quality of life. I don't use words like Gomer, social admission, and failure to die. They're cruel, dehumanizing, and ageist to frail and elderly patients. They demonstrate lack of empathy, and they're unprofessional. I'd never condone their use by others. But here's the thing. Even the health professionals who don't use that kind of slang are increasingly distressed about treatments offered when it's futile to do so. In my opinion, instead of using slang, it would be far better if doctors and nurses had a heart-to-heart conversation with their patients, and if patients and their families thought harder about how much treatment they wish to receive as they near the end of life. I'm Dr. Brian Goldman. There's lots more hospital slang and my take on medical culture in The Secret Language of Doctors.